How does your body status or the shape of your body determine how we choose a breast implant? Now, most doctors who you might have visited or if you've read online would talk to you about the breast base. They would say that we choose the implant according to the base of your breast and perhaps the skin laxity, and then what you like in terms of the shape. But there's one important factor which very few doctors talk about, and that is the body structure. Now, let's examine this in more detail. Most people, most women who are doing breast implants have a sort of a curve here. Unless someone is very obese, they have tires, but most women would have a gentle curve running down the side. And when we are doing a breast implant surgery, it is important to not break that curve, which means if this curve is like this, the implant should not be in a way that it is outside the body and the curve goes here, here, and then here. It should be a smooth curve always. And this is very, very important, especially if you have some amount of skin sagging or if you're looking for a very large breast implant. So you would recall Kylie Jenner very recently talked about her own breast implants, and she chose a moderate profile breast implant. And perhaps she wanted a breast with side boobs. So she wanted this curve to be broken, so she would have the side boobs. But it does not look great in every patient. So if you are considering a very large implant, then you must be sure that you are opting for a side boob as well. And this curve will get broken. There is no option around it. When somebody has sagging, if the surgeon just puts a breast implant, what happens is the breast goes down like this and goes out because of the weight of the implant like this, and it breaks the curve of the body. So this silhouette curve is broken, and therefore we are in a way spoiling the aesthetics of the body. The breast might look okay, but the aesthetics is broken. And therefore, whenever there is sagging, you've got to lift up the breast and place it here so that you recreate that curve. Many times, people who have sagging, this curve is broken because of the breast shape. In order to get a beautiful contour, we would then lift it, augment it. Therefore, we also talk of not putting very large implants. The moment very large implants are done, then we break this curve. So herein lies the question of creating aesthetics versus doing just a breast implant surgery. So if you want aesthetics, then we've got to respect this curve, measure the base diameter, choose the profile accordingly. But there are some women who would just want them big, and then we know that we don't really need to bother too much about this curve, and we are okay in creating the side boobs. So decide this fact before you visit your plastic surgeon. It helps them plan your surgery better.